afternoon once again. So, in the next session, we will be discussing about the different tissue storage solutions and how that affect the way we have been storing our tissues and distributing them. Our objectives will be to discuss briefly about the historical importance, the brief description of the role of corneal storage media, and a classification based on the duration and types of storage. In the postmortem eye, once there is an arrest of aqueous humor formation, there is a depletion of nutrients, and then there is a depletion of the oxygen supply and damage of the corneal cells by gradual autolysis. So the corneal preservation aims to maintain the endothelial cell viability, prolong the duration of the storage, and prevent any infection during transmission. So when we aim to preserve the tissue, it should maintain the endothelial viability, maintain epithelial viability, allow assessment of the endothelial viability, maintain a clear thin cornea during the preservation time, prevent a lot of edema, ensure a sterility of the tissue, allow the transportation over time, allow cold chain maintenance, offer technical simplicity, and maintain the tissue suitability. In addition, it has to also be cost effective too. So the short term, intermediate, and long term, where broadly these are the following types of the media in which we have been storing tissues. So the short term up to 3 days was MK. Moist chamber is not 3 days, it's 1 day basically. And intermediate term is up to 2 weeks, and K-Sol, corneal storage medium, Dexol, Optisol. The top 3 are no longer used anymore. Optisol is what has been and the modification of which is Cornisol is what is being used now. The long-term storages is usually, apart from organ culture, renders the tissue non-viable. So cryopreservation, gamma irradiation, lyophilized cornea, and glycerol preservation, which we have been using, especially the glycerol preservation during the pandemic times. The moist chamber is mostly of historical interest, and sometimes where there is a very resource limited setting, then one may use that where in a moist chamber with a saline gauge, the whole eyeball is preserved and sent in a cold chain. The MK medium is what we mostly rely upon, and it allows storage for up to 4 days, and here the tissues have been stored with a good clarity and good transportation, ease of transportation, and also with good viability of these tissues. And sometimes we may need to transfer them to a long-term storage media such as the Cornisol. And if we just break down each of the constituents of the media, basically the MK media has a tissue culture medium, and also it has a buffer with gentamicin, which is an antibiotic, and 5% dextran, which is the dehydrating agent and keeps the tissue compact. And there is an incremental change as we started developing into the different media. These are the K-Sol, where the dextran was replaced with 2.5% chondroitin sulfate, and then over that, when the cornea storage medium came, then in addition to 2% chondroitin sulfate, we also had the sodium pyruvate, the non-essential fatty acids, and some antioxidants. So this helped to reduce the oxidative lysis in the postmortem tissues. And then was the Dextrol, where the Dexol, where a phenol red indicator was also added, and then in Optisol, which is what we know it now, has the minimum essential medium, which is the Eagles medium, the tissue culture medium 199, the buffer, the antibiotic, 2.5% chondroitin sulfate, and this was arrived at after different concentrations, both 1.5, 2.5, 3 and 5% chondroitin sulfate, and 2.5 yielded the best tissues, meaning there was a balance between dehydration of the tissue and compactness versus the edema that develops as the tissue increases in its storage time. In addition, some vitamins were also added, and dextran 1% was also added to the Optisol medium. Optisol was essentially a combination of K-Sol and Dexol, and Optisol GS, which is the current form in which it is used extensively by the EBA, had an addition of 200 micrograms of streptomycin sulfate. The newer intermediate storage media are Cornisol, Life4C, Usol-C, and Shen media. They have been variably certified by the FDA. However, It's Cornisol, which is a modification of Optisol that has been widely used in Indian eye banks owing to the lower cost, good supply chain and efficacy of 2 weeks storage of the tissue. The long term is not really used in either the American or the Indian eye banks. Organ culture is primarily restricted to the Australia, New Zealand eye banks and also to the European eye banks, and they incubate the tissue at 31 to 37 degrees up to 35 days, and there are means in which they evaluate this tissue regularly and periodically change the nutrients in which the tissue is stored, and there is a concern of tissue thickening and increased chance of contamination in case there is any breach anywhere in the process. The long-term processes are primarily the cryopreservation. The disadvantage of cryopreservation is that whenever we freeze the tissues fast, then there is ice crystal formation and disruption of the cellular organelles, which damages the cell, and when there is a slow cooling, then ice forms in the intercellular space, and when that happens, there is a loss in the osmosis, and the water is drawn out from the cells into the interstitial space, creating a solute injury, meaning that there is a high concentration of electrolytes inside the cell. So to prevent that, what was proposed was some cryoprotectants. These cryoprotectants are DMSO, glycerol or propanediol, and the non-diffusible cryoprotectors are the polyvinyl pyrrolidone, starch and certain sugars. What has been effective in our response, especially during the COVID, was the development of the glycerol preservation. Essentially, glycerol preservation is fairly simple: sterilized absolute glycerol 90%, and that is a media in which the tissue is stored. Usually it dehydrates the tissue, and the tissue is very clear, and before that a microbiology sampling is required to prevent any chance of contamination, though glycerol itself has per se antimicrobial properties as well. And once the tissue is there, it can be frozen at -4 or -20 degrees, and it's allowed to thaw, and then it's allowed to be soaked in the normal saline or the BSS, and then thoroughly rinsed, and then transferred to another bowl where it is kept and prepared before the surgery. Trephination is planned just like a normal tissue, but these tissues can be very tough to work with to start with, and then after that it is refined and transplanted. So this is how the procedure progresses. Colorimetric indices have been added to the media, and usually the normal pH is pink, but when it turns acidic or alkaline, there is a color change to yellow or red, and this indicates that there is a growth of microorganisms. These are some of our experiences with the tissue media. So the second publication was after Dr. Neeti's publication on the glycerol, her experience with glycerol, and this was our intermediate outcomes of therapeutic PK for the glycerol preserved, using the glycerol preserved corneas, and our recent publication on the overview of short-term and intermediate-term cornea storage solutions. So all in all, the functional status of the endothelium and sustained corneal degeneration after corneal preservation are of great clinical importance, and they contribute primarily to the success of the surgical outcomes. So most intermediate-term corneal storage solutions are efficacious. However, at present, long-term media are associated with poor endothelial survival and are also technically complex.